Hi everyone, welcome you to the channel Let's Get Knowledge. Today I am going to talk about something all the women folks likes to talk or know about, especially adolescent age girls who are just entering the adolescent age. Yeah, it's nothing but PCOD or PCOS, polycystic ovarian disease or polycystic ovarian syndrome. Actually what it is, all about PCOD. So we will be going about to learn what is PCOD, what are the signs and symptoms, causes, functions of the ovary, the treatments, the lab tests that the person has to undergo, etc. etc. So let us see now first what is PCOD or PCOS, polycystic ovarian disease or polycystic ovarian syndrome. As we all know, it's a common problem which all women faces these days, and it's of common concern. Because of this, many women remain infertile. I like to call it as syndrome rather than disease. That is PCOS rather than PCOD, because it has to deal with lots of symptoms. It is not just treating blood pressure or diabetes, not just like that, treating one or two disease, but it is treating a group of signs and symptoms. So it should be called a syndrome. Basically, it's a problem with endocrine hormone imbalance. In fact, 1 out of 10 women have PCOS. Okay. What is PCOD? PCOD, that is polycystic ovarian disease. So let us call it as polycystic ovarian syndrome. Okay. PCOS is a hormone imbalance. Basically, it can cause irregular periods, unwanted hair growth, and acne. So here we can see the structure of the female reproductive organ, and it's showing ovary. So the problem here is with the ovary. So we can see a normal ovary and a polycystic ovary in the coming videos. Now let us see the signs and symptoms. So when to doubt, we have this syndrome. So signs and symptoms. Some of the common symptoms include irregular periods. That is, the periods which has to happen every month by 26th or 28th day or 30th day. That happens once in few months, or it is delayed. It becomes irregular. Sometimes it's not happening at all, or sometimes too much of menstruation. Sometimes too much. Sometimes more frequently, etc. Initially at puberty, that when it starts, this menstruation, that period starts for the adolescent girls, it may look like not normal for 2 months, 3 months, maybe 6 or 1 year. But after that, it becomes regular. But as the time passes, month passes, it becomes irregular. So one of the common symptom here is irregular periods. Next is extra growth of hair on the face or chest, etc., etc., just like males. So that condition is called hirsutism, and also the skin becomes oily. Then there can be acne, ACNA. It is also one of the common signs and symptoms. It looks like fluid-filled sacs all around the face. It's not pimples also. It is like under the skin you feel that something is protruded out with like blood-filled sacs, pus-filled sacs, etc. Basically, this acne is seen on the jawline. Next, there can be weight gain. And person who gained weight, it's very difficult for them to losing the weight also. They remain obese. Basically, the body is not functioning properly. So, you gain weight or you won't lose the weight. Then there can be some mood disorders, mood swings, getting irritated fast, etc. There can be patches of dark skin on the neck and other parts of the body. Then there can be also, because of all this, there can be some pelvic pain. Also, there can be sleep apnea. There can be increased risk of developing diabetes, the diabetes 2 type. So when there is irregularities, there may be lack of ovulation. So affected women may experience infertility. So basically it's a syndrome with more than one or two symptoms. So basically it's a syndrome. Next, let us see the functions of the ovary. Let us see how the ovary functions. So our body as a whole is controlled by various endocrine and exocrine hormones. So reproductive system is mainly controlled by the endocrine hormones. Here ovary is the main part of this female reproductive system, which is affected in PCOS. So let's see how ovary functions. For ovary to function, it has to be stimulated. So here follicle stimulating hormone, or FSH in short, and luteinizing hormone LH, it controls the function of the ovary. FSH and LH are produced by the pituitary gland in the brain, and they are in the bloodstream, and they direct the growth of the egg. So follicles in the ovary, every month they mature and egg is released. And when egg is released, it produces the female hormone, sex hormone, that is the estrogen hormone. From the LH from the brain helps in releasing this matured ovum or egg. Luteinizing hormone helps in releasing the egg out, and that process is called ovulation. That is, the follicles break open and egg should be released. So that function is called as ovulation. So LH from the brain helps for the release of these eggs, and follicle stimulating hormone helps in stimulates the follicles to mature. In case of PCOD, high amount of LH is released into the bloodstream. This obstructs the release of matured ovum, and this results in infertility. So the follicles which is not matured remain as fluid sac or cyst. So it is like seen as cyst when you take a sonography. At this point, doctor can find out that there is high level of insulin combined with LH, and this both are combined together and can lead to the high level of testosterone, that is the male hormone. Now, testosterone to some amount is already in the female body, but at this point there is high level of testosterone, that is the male hormone. So male-like symptoms of acne, hair growth on face, etc. can be seen. There are, because insulin is seen in the blood, then the risk of diabetes 2 will be there. Then it can lead to heart disease, high blood pressure, cholesterol abnormalities, etc., etc. So these are the function of the ovary. Let us see the causes of this polycystic ovarian syndrome. Exact cause is not clear. Actually, nobody knows why it happens. There is some evidence that there can be an inherited cause, that is genetic cause, that is mother, auntie, grandmother, etc. suffered. There is statistics that the offspring, the children, the younger generation facing that. So there can be a genetic cause, but it is not stabilized. There can be some lifestyle changes because of that also. That is that also can result in PCOS. That is the diet we take, the exercise, etc. That is basically it is because of lifestyle changes this syndrome occurs. There can be presence of small cysts in the ovaries, so that can also stimulate. That can also be seen as this syndrome because of the small cysts presence in the ovary. There can be all this syndrome, but it is not specific for PCOS. Since women who do not have PCOS may have ovarian cysts, therefore the presence of cysts is not likely to be the cause of symptoms of PCOS. When to see medical care for PCOS? When to seek? It's appropriate to seek the advice of healthcare practitioner or physician if you have irregular or absent menstrual periods. So that is the point when you doubt that you have PCOS. That there may be abnormal or excessive hair growth, difficulty in getting pregnant, or any other symptoms of PCOS. Then we have to seek the medical care for this syndrome. Next, let us see the examinations and tests for PCOS. The characteristic symptoms which are seen may lead to diagnosis of PCOS. That is all these irregular periods, not getting pregnant, growth of hair on the face, etc., acne, etc. These symptoms may lead you to think that it may be PCOS and doctor may diagnose. A number of laboratory tests can also help in establishing the diagnosis. That is to see the level of hormones like estrogen, progesterone, etc. in the blood. Also, the thyroid hormone, the thyroid gland producing the hormone, all these, the adrenal glands hormone, etc. So we have to see the various level of hormone. Then by ultrasound studies, we can find the cysts, that is small fluid filled sacs, but it's not conclusive. So these cysts are nothing but immature production of follicles. That is halfway the maturing, halfway it is stopped. It is not fully matured. So that becomes cysts. In some cases, when tumors are suspected, CT scan, MRI scans may be ordered. So these are some of the tests conducted. Then what are the PCOS treatments? Basically, for this, it has to first deal with the lifestyle changes. That is dieting. If you are overweight and obese, then start dieting and exercising. Then we have to maintain our weight by weight losing exercise and by diet. We have to change our lifestyle. Then pharmacologic treatments, that is the treatment combined with estrogen and progesterone. Also oral contraceptive pills. So this may be ordered by the doctor, physician. If by taking this hormonal treatment, then the periods can be taken care. So because of that, acne, hair growth, etc. May be kept under control. Then treatments can be according to specific needs of the patient. If it leads to diabetes, then treated for diabetes, etc. If, as I told, if it's not getting pregnant, the person is not getting pregnant, then the treatment has to be for ovulation and pregnancy. And if the person is not married, then maybe to stop the ovulation, etc. Then psychological steps also helps in reducing the stress, that is meeting a psychologist for counseling, etc. Then surgical part. Surgery, laparoscopic surgeries may be needed for identifying this cyst, for sample studies, and also maybe to remove this cyst. So surgery is also a treatment. And if the person is diabetic, then the treatment has to start. For usually metformin is the drug of choice when the person has diabetes. Also, patient who wants to get pregnant should be treated by a gynecologist. Overall, we cannot be assured that it can be healed or cured completely, but it can be controlled. That is, it can be kept under control than becoming worse. So I dealt with various things now. So exercise, lifestyles, diets, naturally how to treat it, etc. We can see in the future videos. Please like, share, and also subscribe my channel so that whenever I post new videos, you can get notifications. Bye.